A prominent plastic surgeon in Beverly Hills, Dr. Payman Simoni. He's pioneered a very exciting and much less invasive but still incredibly effective facelift called the Simoni lift. So what exactly is the Simoni lift?
In a nutshell, Simoni lift is a 1-hour procedure that is done without going under any anesthesia. And it turned the clock back about 10 to 15 years, and it lasts for years and years. It has an immediate effect. People immediately after an hour, they see the change. They see that the neck is tightened, the jowl is gone, their face is smoother, just like they looked 10 years ago. We're using the fat and muscle of the face to lift them and put them back where they used to be. However, it looks more natural than a traditional facelift. They don't get that pulled look because when I do the procedure, I sit them up as opposed to when we do it under general anesthesia that the person has to lie flat. So when they sit up, I can see their face, I can move the face the way I want it to, and at that moment I know where the face has to be. And when I finish, the face doesn't look like somebody else. It looks like the same person as they were 15 years ago.
I'm afraid to be put under. And I've been put under many times. I've been, like flying, I'm afraid to be put under. And they do it with just numbing your face. And I've known other people who've had it done, and it's bearable. It's not painful. And that's what really one of the big factors.
I was really stunned when you told me that the most dangerous part to getting a facelift is going under general anesthesia.
More people now trying to do procedures under local and become safer and less problematic.
And the recovery process is so much faster, isn't it?
Absolutely, because a lot of swelling and bruising and bleeding is caused by anesthesia itself. Anesthesia, gases, and medication, what they do is they cause vasodilation, meaning that their vessels, they increase in size and they bleed more. And that causes more swelling, more bruising, and possible chance of hematoma, which is blood under the skin.
I've seen the DVDs of your patients actually undergoing this procedure, and it's stunning.
I feel pulling, I feel tightness when I'm talking to you, I feel tight. I mean, I'm pleasantly surprised. I really am. I thought, it's something I would do again.
In a 1 hour as opposed to 6 hours with traditional, the incisions are smaller. We hide it very well in the hairline. We don't have to change the hair pattern. There's much less bleeding. A lot of bleeding caused by anesthesia. It's not only the surgery itself. When there's not much bleeding, there's less bruising. Instead of people hiding in home for 2 weeks, they can get out, go to work in 7 days.
Great, absolutely amazing, and it was virtually pain-free. It was, there's a little pain, but it was minimal. And so I'm a little swollen now, but I feel great.
This gives a very natural, beautiful look. It does not change a person's face. It just brings them back to where they were 10, 15 years ago. And that's the beauty of it.
The surgery, I was so excited to be there that I felt nothing, not only because I was excited, but the shots that he gave me were amazing. It's worse to go to the dentist. It's worse, seriously, it was nothing. I never felt anything but a little bit of pressure. As soon as I was done, I stood up, I looked, I was a little bit swollen, puffy, which is, understandable. And within a week to two, you could just definitely see where the improvement was going to come up. My face was fuller.
My face definitely, I don't have this wiggly thing going on here that I couldn't put a turtleneck on it. It would go over the turtleneck. I feel people, because from far away I think I always look young, and I feel more comfortable when someone gets closer and I look better, close up. It just, I don't know, really, I feel more confident.